So I think we've got everybody here. Welcome to you all. Thanks for joining Council's webinar. Thank you to Professor Charlotte Hespy and Dr. Amandeep Hansra, who are with us and will be answering questions that have been submitted. I'd also like to welcome our state member, Jodie McKay, MP, for attending. I would like to begin by acknowledging the Wangal people of which the land we are present, and pay my respects to elders both past and present and that are joining with us today. Can I also just remind you that this meeting is being recorded, so it's on record for Council's records. Just a little bit, we're going to ask Professor Charlotte and Dr. questions, and we're going to rotate, and then they will probably bounce off each other. There's just under 20 questions available, so we're going to slot some time in. The chat has been turned on, but we won't be taking questions from the chat. We will try to take questions if we have some time left over, because we have to finish up just after 7, so probably about 7:05. We'll have to finish up. Just quickly also as a way of introduction, before I ask the first question, Professor Hespy is the chair of Royal Australian College of GPs for New South Wales and the ACT. She's also the head of general practice and primary care research at the University of Notre Dame, and a co-owner of a general practice in Glebe. Dr. Amandeep Hansra is a GP who holds positions on the Australian Medical Association and Royal Australian College of General Practitioners. Jodie, did you want to say a quick word before I start with our first question?
Yeah, I'd love to, just to say hello to everyone, and thank you very much, John, for hosting this. Can I also just acknowledge the great advocacy that you have made to try and sort out Burwood as a LGA of concern. Obviously, our numbers are pretty low. You and I have written to the Health Minister asking why we're still an LGA of concern. But I just want to thank you very much for the great work you're doing. And it's terrific to host this. I've had my vaccine, obviously, AstraZeneca, my 2 shots. And thank you to both of our expert panelists tonight for answering questions. And hello to everyone. It's lovely to see you. And remember, my office is open to support you. We're looking after people with food, with general support around understanding the restrictions. There's a whole range of issues that we're dealing with. So if you have any issues, just give us a call or send us an email, and we're happy to help.
Thank you, Jodie, and welcome. Just quickly, we're going to just talk through some of the key issues in regards to getting vaccinated right now, which includes why the Delta strain of COVID is such a game changer, AstraZeneca and Pfizer, so what's the difference? Should I wait for Pfizer, or is it too risky? Where can I get vaccinated, and what do I need to do? And what high vaccination rates means for Burwood and Australia. So they're the topics we're going to cover. So Dr. Hansra, I might start with you. How does the COVID-19 vaccine work?
Thank you, Mr. Mayor, for having me here tonight. And I just want to thank everybody for attending on a Friday night. Not that we can do much else in lockdown, but I'm really grateful that you're coming to learn more about vaccination, because it really is our weapon against this pandemic. So vaccines have been around since the 1700s. This is not new. This is not new technology. Vaccines are safe. We've been using them for lots of other diseases and have actually managed to solve a lot of other pandemics in history. But essentially the way vaccine works is it's a safe way of producing an immune response to the body without causing an illness. So I sort of treat it like it's coming in to help you train an army, so that when you are exposed to COVID, the actual disease, you recognize it and your body's immune system acts as that army to fight it off. So really the vaccines that we've got available are either killed or weakened versions of the virus that help our body's immune system get ready, recognize and fight it off, so we don't end up with severe disease, hospitalization or death from that disease. I might keep these answers short because I think we're going to cover a lot. So I might just hand back to you unless Charlotte wants to add anything.
Professor?
I'll probably add more as I talk on the next question.
Okay. Well, Professor, then we'll go into the next question. What is the difference between the 2 vaccines and the upcoming Moderna vaccine?
Thank you, Mr. Mayor, and I'll just quickly say the same things as Dr. Hansra. It's a pleasure to be here, and thank you everybody for being here. And I'd like to also acknowledge the traditional owners of the lands that we're all sitting in tonight. Look, the two vaccines that we have use two different technologies for delivering exactly what Dr. Hansra was talking about. So what we know is that in the COVID environment, there's been about 43 different research institutions trying to actually develop a really good vaccine for us. And in Australia, we invested in basically 4 of them. So the AstraZeneca and the Pfizer are 2 of these, and they use different technology to deliver us with, I like to call it a key, to open up our immune system to be ready to initiate that army of response if we actually get exposed to COVID. And so what they did, they're very clever. They found that the spikes, everyone would have seen a picture of that COVID vaccine, and it's a spiky little sticky thing. And those spikes on the vaccine are the way in which the virus gets into our bodies. And they stick, they're a bit like, you know, when you go out into the wind and you get one of those pollen balls and they stick onto you. They're very much like that, except obviously much, much smaller, and they get into our respiratory tract in the first place, which is why it's so important about us protecting our mouths and our noses with masks. But those little spikes, they've taken the most important part of the spike, which then our immune system can use to actively fight and prevent that virus doing the nasty things to us that it otherwise does. But they use 2 different ways of doing it. The AstraZeneca one has used a virus that actually usually infects chimpanzees. So this virus doesn't infect human beings at all. It just causes disease for chimpanzees. It's called a rhinovirus, so it's slightly different, but rhinoviruses in humans give a cold-like illness as well. So it uses that rhinovirus it gave that rhinovirus the same message as the coronavirus or the COVID virus, so that when we get exposed to that particular pattern of virus, we actually create the key. That means when we do get exposed to the COVID, we rapidly bring into line all of the immune army that we need to do. So it's using a virus as what we call the vector to give us the immune response. So it's not the COVID virus at all. It's a different virus, but it gives us the same, it's like going to the locksmith. You give it a key, you get the exact replica to be able to do the unlocking. So it does that, but with a different virus. The Pfizer is actually quite different. It uses a really, really new technology where it actually uses a thing called messenger RNA, where the messenger RNA is part of our whole system of being able to tell cells what to do. And it uses this technology to give a message to our cells. It goes into the cell and it says, this is the spike virus of the coronavirus. Make a whole lot of protein ready to fight it. So again, it's delivering the same spike as the AstraZeneca, but in a different way. Instead of through a virus, it's actually through a technology where it's delivered to our own cells, and it's our cells that then directly make the response. I hope that's clear. Mr. Mayor, you can tell me if I have made that clear enough or not.
And just on the Moderna, so how is the Moderna vaccine?
Moderna, yeah, great question. Moderna is exactly the same as the Pfizer. It's a different company, but it's using the same technology. So we call it an mRNA vaccine. So both Moderna and Pfizer are the same, which is why they've got very similar sort of side effects. Whereas the Novavax is the same technology as the AstraZeneca. So it's using the same idea of using a virus as the way of transmitting it. So we have sort of basically 4 vaccines potentially in the country that use 2 different technologies.
Awesome. And so really what they're doing is the way they're made is just training your immune system to fight the virus. So it's not the actual vaccine, it's your immune system.
That's exactly right. So it's not the actual virus, it's a bit of the virus So what they found is that with all viruses, there's one part that our immune system will actually detect, respond to, and then use that as the mechanism to come and fight it with our white cells. So we've got an army of white cells waiting to go, but our whole antibodies, it's how all the vaccines work. So as everybody's had their diphtheria, tetanus, whooping cough, hepatitis B, all of those vaccines use similar but different technology to deliver the same sort of message to our immune system. The flu is different, the flu virus. It does what we call an inactivated virus. So for the flu, they are actually using the actual flu virus itself, but they stop it being active, but they use the pattern of that virus to then give us a flu vaccine.
Excellent. I watched a video which showed that it was sort of like a bit of an animation that explained it really well. And it showed when I was doing my own research, and it was pretty much like a wanted, the old wanted signs in 100 years ago in Western America when they were wanting outlaws. So it's training your immune system to have the COVID sign as a wanted sign. So when it sees it, it goes out and attacks it. Excellent. So Professor Hespy, just on that also, following on that, so what are these vaccines actually made of? Conspiracy theories going on social media at the moment. People are saying, they're coming from all these different things. Can you sort of clarify how they're made or what they're made of?
Well, it's quite complicated, but basically they use proteins in a laboratory to be able to generate that message. It's incredibly high tech, and they use a variety of different messages to make that particular protein message. Sometimes they'll use other cells. A lot of the fantastic medicines that we use an animal cell to actually pump out those proteins for us. So in the same way, that's what they do with a lot of this technology. But the things that a lot of the time we react to is the sort of the proteins that the vaccine itself sits in to stabilize it, what we call neutralize it, so that it's able to be ready to go when it's injected into us, which is why there's a lot of this sort of needs to be stored very cold, and then we dilute it down, and then we have to and we keep it in fridges at a certain temperature, so it's kept exactly the same all the time.
Sorry, and just quickly before I go on to the next question, one of the questions we get asked a lot about, or you hear people talking about, is will the mRNA, which is the Pfizer vaccine, change your DNA? Yeah, look, and that question has come because of the fact that this is called a messenger RNA and it goes into your cells. And so, no, it doesn't change your DNA at all. Messenger RNA's job is not about changing DNA. It's pretty much like a postal service. So basically what it's doing is it's actually acting like an envelope. It puts the message that we want inside an envelope, and it then finds the right postal box hole, posts it into our cells, and then our cell, which is where the DNA comes in, actually has to respond to it. And our own cell then makes the protein, which is in a DNA form, to respond to that key message. But it doesn't change our own cells in any way. It's just giving us that key message about how do we respond to the COVID virus when we're exposed to it. Thanks, Professor. And Dr. Hanstra, so leading on to yourself, will we need 2 doses? So do people need 2 doses? And there's a lot of talk now with what's happening overseas. Will we need a 3rd dose or a booster dose here in the future? And what are your thoughts on that?
Yeah, so great question. Look, both vaccines that we're using currently in Australia, the Pfizer and the AstraZeneca, both require 2 doses. And people would have been told about some of the changing kind of intervals we've been talking through with both of those, which are in response to what's happening in the environment. So with AstraZeneca, some people might have heard that we've brought the 2nd dose forward just to be able to get more people to have 2 doses, because we know that 2 doses are better than 1. So what happens when, as Professor Hespy was talking about, this vaccine enters our body and encounters our immune system, it activates 2 different types of white blood cells. and these are the cells that are going to fight the infection. So they have these cells called B cells, and the B cells make antibodies, and many people would have heard about antibodies. So antibodies sort of are generated against the specific virus that that vaccine's for. So in this case, against COVID. Now that cell is kind of short-lived. So it's like the army that you train up and then they get a bit lazy and they sort of forget and they have a bit of a sleep. So a few weeks after you've had the vaccine, you might have a lot of those antibodies, but they start to sort of go down in their amount unless you give that booster. So when you go in for that booster and there's that specific time period, because they've been extensively tested and researched, and those are the time periods recommended by the manufacturers of the vaccine, there is activation of the second types of white cells, which are called the T cells. And the T cells, they're called memory T cells because they hang around for longer, and in some cases even hang around for decades and remember how to identify those particular virus particles, so recognize COVID potentially. So those T cells that have that memory are really needed for that longer term protection. And you don't get a lot of that with just one dose with these particular two types of vaccines we've been using in Australia. So we do recommend for the full course that you get both of those vaccines. So you get both kinds of white cells activated, those B cells and those T cells. So that second exposure to the vaccine is the one that's going to create that strong immune response to fight the virus that you need. Now, people are asking, what about the third booster? What about, like with the flu shot, we have to get it every year. And we are still doing a lot of trials around when we think we're going to need booster shots, if we do, and when we will need those. So there's lots of clinical trials. Some of them have started to publish some data saying that there is some evidence that our immunity does start to wane after a period, and that for some people in particular, and you'll hear in other countries, that they're starting to give third doses to people who are immunocompromised. So those people who don't have very strong immune systems and may not have responded very well to the first two doses of the vaccine, because you've got to remember, when we give you the vaccine, we're requiring your immune system to mount that response. You're training your army. And if your army isn't very strong, they might need another prod, like a third dose. And so some of the countries have started to give third doses sort of 8 months after the first course. We don't yet have an idea of when booster doses will start here in Australia, but there is a likelihood that we will be needing more doses, and you will have heard that we've started to order those, and there'll be a lot more vaccines coming into the country in the new year, and including Moderna and some other vaccines. So the third doses most likely will happen, but we just don't have a specific time frame interval yet.
Okay, and just on that, so do we know if we're going to need like a yearly shot, like the flu shot, for example, or is that still, we're still unsure about, or is science still unsure about that?
Yeah, look, we're still unsure about that. I mean, one of the other reasons we have regular annual sort of flu vaccines and some of the other vaccines that we have more often than once is because there are variants that can come about. So this is where there's slight variations in the virus, and people have heard about the Delta variant to death. So those sorts of things mean that there might need to be a slight tweaking of the vaccine every year to account for those changes in that virus. So it's like the virus comes in and says, oh, look, I know you've trained your army this way, but if I try this other mechanism to get into your body and affect you, then I can evade your immunity. And so we will have to then give them a vaccine that is I guess in response to that variant. So it's likely that as long as we have variants sort of appearing, that we will need to modify the vaccine and give regular boosters. But again, so much of this is early stages because we haven't monitored COVID for years and years like we have with other viruses to know what might happen into the future.
Okay, and so just on that, there's some people that are talking and asking questions. Can you get a mix of the vaccines, like get one shot as AZ and one shot as a Pfizer, or is that recommended? Or
so the recommendation is for your two shots is AstraZeneca or Pfizer, and you should get the same for that course. The only reason you might not have, if you've had an AstraZeneca, you might not have the second, or a Pfizer, you might not have a second, is if you've had a serious reaction to the first one, in which case, you know, you get doctors involved and there's a decision made to not give you another dose of that same vaccine. But that's incredibly rare. Everyone else is recommended, if you've started with AstraZeneca, to have the second dose of AstraZeneca, and same with Pfizer. Now, in terms of boosters, that may change for boosters, but certainly for the first two, you should stick to the same vaccine type.
Okay, excellent. And just quickly before I head back to Professor, you mentioned variants of the virus and how it's moving from variants. Is it more likely if you have more unvaccinated people in your populations that it will become more variant and it's as a virus, or does that not matter?
Look, what we're finding globally is that the variants that are emerging tend to emerge out of countries where they've got massive, large-scale outbreaks. So, for example, people might be reading about the Mu variant, which, you know, started in Colombia. There's been Lambda, which was also South America. So often it has been in response to lots of the virus circulating in an environment, allowing the virus to mutate in that environment because lots of people have got it. So certainly the faster we get people vaccinated, you know, the larger coverage we have and the quicker we kind of manage the outbreak, the less likely we are to have these emerging variants that come up. So definitely, you know, what you're saying, Mr. Mayor, is correct.
Okay, excellent. Thanks, Doctor. And Professor, so just back to you. There's been a lot of talk about risks of vaccinations. Can you talk us through some of those, if there are risks and what they are?
Well, I think there's been an awful lot of information around about the risks associated with vaccines. So it's like anything. There's not a medication that doctors prescribe that doesn't have some potential adverse reaction associated with it. And so conversations that we always have about any prescribed treatment is about weighing up the risk of the medication or the vaccine versus the benefits. So with AstraZeneca and Pfizer and Moderna, there are slightly different risks associated with both. But let's start at the beginning. All vaccines, by and large, and everybody will know this, tend to create, for some people, a sore arm and sometimes feeling achy and a bit off colour in that sort of first 24, 48 hours after having it. Lots of my patients tell me about it from the flu vaccine. It seems to be quite common. Lots will tell me that they got the flu when they got the flu vaccine. So, you know, whatever. So you often will get symptoms similar to that particular illness. So in the same way, COVID vaccines will do that. We're seeing probably about 55%. So you're more than likely to get a sore arm and to feel a bit sore and achy and get fevers. With the AstraZeneca, you're more likely to get it first vaccine and not very much with the second. With the Pfizer, it's the other way around. You don't tend to get very much happening with the first, but you do with the second. The other thing that we're commonly seeing with both, but probably more with Pfizer, is your lymph nodes get quite sore and enlarged. Now, when we're talking about lymph nodes, most people sort of know about it. It's, you know, you get lumps under your arms or in your neck, and it's because we do the vaccine in your arm, it's quite common to get sort of tender, swollen, painful lymph nodes in your arm and on that same side. As I say to my patients, that's a good sign because it shows that you're actually doing exactly what we want you to do, because the lymph nodes are where those white cells that Dr. Hansra was talking about actually go and live, and actually it's their camps. It's like their army camps. They stay there until they're needed. So if you get those lumpy, sore reaction, then your immune system is doing a good job. But then the thing that everybody really does talk about, there are two things. One, with the AstraZeneca, there's this very, very, very rare syndrome called TTS, which is a shortened term for basically it's a specific reaction to the vaccine. It is not related to any other medical condition that people have. So it doesn't matter who you are or what you are. nothing that you have that causes this. It's just a very, very rare vaccine only associated thing where your platelets, which are the little blood cells that cause you to help you clot, make blood clots, get attacked. Your own body attacks them. So you get falling numbers of the platelets. So it means that you actually might bleed, but it also makes the platelets sticky. So you get these two things happening. You actually get you can bleed, but you can also clot. So although you don't have very many of these of the platelets, they're actually more likely to cause clots. And so we know that if you don't pick that up, there is again an even rarer, but obviously you don't want it to happen, risk of people dying from it. But we're talking, if we look at Australian data, it's about 1 per 1.5 million doses of vaccine, people will die from this disorder, all right? Now, 1 per 1.5 million, that's not very common, all right? Like really not common. And we're far more likely to get clotting just because something else happened. You're far more likely to be hit by a motor car crossing the street than for this to happen. But because we have 25 million people in Australia, it is going to happen. Okay, so that's the big thing we need to know. So that's the AstraZeneca. And with the Pfizer and the Moderna, they seem to, with young men in particular, but anybody can get it, cause an inflammation in the heart. And we call it myocarditis and pericarditis. The myocarditis, that's the muscle of the heart, and the pericardium is the cover of the heart. Both of them can get inflamed. Now, the good news is that basically it doesn't kill you, but some people can get quite significant chest pain and discomfort and might need to be in hospital for a few days for that. But again, really rare. We're talking, 1 per 500,000 doses of the vaccine to actually significantly affect you, but probably a bit more common for people to get a bit of discomfort in their chest.
Thanks, Professor. So if people have an underlying medical condition, what should they do, for example, before getting vaccinated? Look,
I recommend everybody who's got any questions about the vaccine, talk to your GP. Your GP knows what your underlying conditions are. They know your age, your medical, your risk of being sick with COVID. And it's sort of one of those issues where if you're worried about having the vaccine because you've got medical conditions, actually you're far more at risk of being significantly unwell with the COVID virus itself. So you're actually much better off having that vaccine than you are saying, oh, I'm too scared to have the vaccine because I might get sick. Well, actually, you're right, you might get sick and you might actually die from COVID. And we're looking today, there were 12 deaths from COVID today, and most of them were elderly, but there were some people who were in, well, we've seen there have been people in their 20s and 30s, and somebody in their 30s died at home from COVID. It's just not okay. And we need to protect everybody from that much higher certainty of being sick and dying from COVID itself than this really, really rare risk of having a side effect from the COVID vaccine.
Okay, thanks, Professor. And Dr. Hansra, just back to you. So we're hearing stories that people that are vaccinated are still getting COVID. And what happens if you do get COVID if you are fully vaccinated? And what could it do?
Yeah, look, Mr. Mayor, you're absolutely right. You can still get COVID if you're vaccinated. And I don't think the vaccines were ever communicated as being the thing that stops you 100% from getting COVID. What we are trying to communicate, though, if you do get COVID, you're much less likely to end up in hospital, have a serious sort of disease course, end up in intensive care unit or die. And as Professor Hespy was saying, a lot of the deaths that we have heard of, and each of them is tragic, they were people who were unvaccinated. I think the research from the UK has shown that if you're vaccinated, you're 97% less likely to end up in hospital, even if you do get COVID. So for those people who are vaccinated who get COVID, they will either have what's potentially an asymptomatic infection, so they don't actually even notice that they've got COVID, or they will have very mild symptoms like they would have a cold or a flu-like illness. And that's what we're really trying to achieve here, is to keep people out of hospital, help them, go down the path that if they are going to get the disease, that they have a much milder course and that they're much less likely to pass it on as well, just with those decreased symptoms.
And can I add in there, if I can, that too, if you do get vaccinated and you do end up in hospital, you can be pretty damn sure that you're far more likely to have died from it than if you hadn't been vaccinated, because if you were sick despite being vaccinated, you're a person who was much more vulnerable. So again, it's, it shows the value of being vaccinated for people who do get sick anyway.
So Professor, just on that, if you just want to continue, so who's eligible to be vaccinated and where can they get vaccinated?
Okay, so we're so lucky in Australia. Basically, our government has paid for everybody who is eligible to be provided with the vaccine for free. So that is, everything about it is paid for by our taxes. And at this point in time, everybody who's 60 and over is eligible for an AstraZeneca. They're not eligible for a Pfizer, so it's just AstraZeneca. And can I just add in there, we know that the data actually shows that if you are in that age group, you actually do better with an AstraZeneca than you do with a Pfizer as well. So a lot of, I have people who tell me they feel pissed off that they don't get choice. And I understand that, we all like choice as Australians, but the evidence does say AstraZeneca, not only is it a really good vaccine, but it's actually, the evidence is very good when you're elderly, or elderly. I don't consider people who are 60 and over elderly, but the older you are, the better AstraZeneca is in terms of protecting you. Then everybody aged 12 and up to the age of 59 are eligible to get Pfizer, and everybody aged 18 up to 59 are eligible to get AstraZeneca. So the only people who can only get Pfizer are the 12 to 18-year-olds. So AstraZeneca is not licensed to be delivered to under 18s, and Pfizer is not licensed for anyone under the age of 12. So at this point in time, we've got no vaccinations for anybody who's younger than 12. Pfizer only for 12 to 17-year-olds, and AstraZeneca and Pfizer for everybody 18 to 59, and AstraZeneca for 60 and over. If you are 60 and over and you do have a reason not to have AstraZeneca, then you are able to access Pfizer. And so Dr. Hans was talking a little bit about people who might have had a significant adverse reaction, or they have some other particular reason why they might not be wanting to get AstraZeneca, or might not medically be eligible for AstraZeneca.
So Professor, just on that, because you touched on a really important point with AstraZeneca and how effective it is, and there's I guess I see it in my role, there's some hesitancy for people to actually take it up. But AstraZeneca is actually, and you might want to elaborate on this, is the traditional way that vaccines have always been made. While you mentioned the Pfizer's a new technology, AstraZeneca. That's
exactly right. So it is a technology that we're far more familiar with, and we know it, we trust it, and we understand the long-term consequences. Pfizer is much, and Moderna are much newer. Having said that, both of them are performing fantastically well in terms of doing what we need them to do in terms of protecting us from, as Dr. Hanser talked about, being so sick that you need to go into hospital and or then ending up in ICU and or then dying. And there's also some good evidence that both the vaccines protect us from what we call long COVID. And I think a lot of people aren't talking enough, I don't think, about long COVID. And that's where people, particularly young people, get the virus not that badly, but enough to know it, a bit like having a bad dose of the flu, and then continue to have quite significant problems with their health afterwards. So, for instance, I've got a young woman that I look after who got COVID in America, so she didn't have Delta. She got the original variant. She was sick enough to be, quite significantly sick, but now 18 months later, because she got it back in February last year, she has still got problems with her heart. She's still got problems with her lungs. She's tired, she's fatigued, but she didn't need to go into hospital. She was managed at home, yet 18 months later, her health is really poorly affected. We know that with the vaccine, it protects from that as well.
And Professor, that's great, and thanks for answering that. And just to quickly touch on that before I go to Dr. Hansra, is I've seen many examples of residents and people that I know that have actually sent emails that have caught COVID. And I think we've seen a lot of these stories where they were people that didn't believe in vaccination, and now they're actually encouraging people to be vaccinated because they're getting some of those experiences of long COVID that you've mentioned there. So it's really important. So Dr. Hansra, the next question was possible side effects and what you need to do if you experience side effects. I think we've sort of covered that, but you might want to talk about if you do experience some side effects from the vaccine. Usually I know that they make you wait for 15 minutes because if you are going to get a reaction that happens in the first 15 minutes, but do you want to elaborate on that?
Yeah, look, thanks, Mr. Mayor. So as Professor Hespy sort of mentioned, there are some side effects from the vaccine which are expected and kind of welcome, showing us that your immune system is doing its job and starting to mount that army in preparation for if COVID ever hits your body. So that's a good thing. The first 15 minutes is really for those immediate reactions if somebody's going to have anaphylaxis, an actual allergic reaction. So we do keep people around, we observe and monitor them. And then when they go home, that's when they get those other sort of sore arm. We've had a few people with sort of what they call COVID arm. They get the soreness, so they might get muscle aches and pains, and most of those are self-limiting. So you don't, if it feels like, your usual kind of response, and people have had it before when they've had a flu shot or something, taking paracetamol or something that you discuss with your doctor, and just resting up, and usually that goes away. I think the side effects that we worry about are some of the ones that Professor Hespy mentioned, where if you are one of those really rare people that is going to have that bleeding and clotting syndrome that we talked about before with AstraZeneca, that's where if you have an unusual symptom, and the unusual symptoms can be something like a severe headache that doesn't go away with just simple rest or pain relief, chest pain, shortness of breath, severe abdominal pain, any funny bruising on your body or funny sort of pinprick signs anywhere on your skin, those sorts of symptoms are ones that you should go and see a doctor about. And we can do a blood test, and with that blood test we can diagnose if you've got that syndrome, and we can treat. The important thing to remember with that is that a lot of people forget that they've had a vaccine, or it's not the front of their mind after a few days post the vaccine. So that syndrome, as rare as it is, can happen even up to 42 days after you've had the vaccine. So I sort of say to patients, even almost like 6 weeks after you've had the vaccine, just to be wary of any funny symptoms that you're not sure about, and always err on the side of caution. Your GP is not going to get upset with you if you go and see them. If you turn up at the hospital with any of those severe symptoms, no one's going to say, oh, you're silly for coming in. We really want to encourage people that if you present, we can treat you, we can diagnose and treat it, and that, it is incredibly rare, but just to keep it at the back of your mind that, within that period. And it goes same with the Pfizer vaccine, with that sort of, again, not common side effect of having the myocarditis, the heart inflammation or pericarditis, that again, if you have any symptoms that seem worrying, if you've ever got chest pain, you should really be seeing a doctor. Get medical attention. We're all the general practices are still open. We're still seeing patients. We still want to encourage you to come and talk to us about any of those concerns.
So if anything serious like an allergic reaction is going to happen, it usually happens in the first 15 minutes. Is that correct? Usually.
If it's going to be a serious reaction, yes. That's why we monitor people.
And just a quick one, because I've received emails about this. Pregnant women, what are the effects that could happen to them if they get vaccinated? And should they get vaccinated or not? That's the question.
Yes, they should absolutely get vaccinated. In fact, they're at higher risk of, poor outcomes if they do get COVID. And you've got to imagine many of these women may well be going into hospital, and the risks of contracting COVID may be greater for them. So all of the peak bodies around obstetrics have absolutely recommended vaccination for pregnant women. So we're definitely prioritizing women, and if you're trying to get pregnant, if you're breastfeeding. And there's also the benefits and evidence suggesting that some of that immunity gets passed on to the baby, which is incredible and important considering the situation at the moment with the outbreak. So absolutely, pregnant women should seek their GP or their obstetrician's advice if they haven't been vaccinated yet, to get that in as soon as possible.
And one that gets...
Sorry,
Professor.
I was just going to add, and that's at any stage of pregnancy. So it doesn't matter whether you're very early on or if you're already later. It's safe at all stages and is recommended by both GPs and the obstetricians.
And what about for those that are trying to conceive a child? Is there any evidence to suggest that vaccination could lower your fertility?
No evidence whatsoever. It's another one of those myths floating around. But look, if you're trying to conceive, even more important that you get vaccinated. And just to Professor Hespy's comments around any stage of pregnancy, I've had women come to me saying, I won't get 2 doses in before I have the baby. Doesn't matter. At least if we get 1 dose in, and then we can still, plan the second one for once you've delivered. But it's absolutely critical that you still start on that journey, even if you feel like the birth is going to interrupt it somehow. Absolutely critical. And definitely, if you're trying to conceive, it's completely safe to have the vaccine in that period.
Well, my sister had a very close friend of hers who was trying to conceive for years and couldn't conceive, but had the vaccine and has since conceived. Now, it's not because of the vaccine, it's just by natural causes. So it does happen. Okay, excellent. Now, Professor, just back to you. So with the Delta variant, which is the game changer now and which is affecting, our community and our country, what's the potential for people to transmit it with others? So why is it so different to normal COVID that we had last year?
Yeah, it's a really interesting question, Mr. Mayor. And we basically, right at the start in Sydney, that we noticed how much worse it was at being infective. So if I go back a year ago, if you were infected and you were at home, probably 1 in 4 of your family members would get infected from being exposed to you as a close contact with that COVID variant. Now, with the Delta, what we're actually seeing is 100%. 100%. So that means every single person in a household who is exposed to the family member who is positive is also getting COVID, unless they're vaccinated. So we're seeing some really good stories about the protection of vaccines. So just again, if I use my own practice as an example, we have an elderly lady who's she's 65, she's not that old, but she's fully vaccinated. She lives in a shared household with her family. One of the children picked up COVID at school and has, oh, sorry, I've got a dog, 1 moment. The joys of dogs and COVID lockdown, yes. So basically every family member has actually subsequently developed COVID, except for herself and her husband, who both were fully vaccinated with AstraZeneca. Again, a really good tribute to the value of being vaccinated, because they were the most vulnerable members in that household. And nobody else was vaccinated. But what we do know, yes, so it's highly, highly infective. It is much stickier and you need less of it in order for you to pass that infection on. Again, why we have to be so much more careful with wearing masks when we're out and about, because the variant last year, it might have been in the air, but it was much less likely to actually be transmitted in a public place. Whereas this one, it goes finding people, it sticks to you and it causes infections. So just beware, wear those face masks, because apart from vaccination, can I tell you, your absolute armour that you need to have on is a face mask that is on your nose as well as your mouth. I see lots of them underneath people's noses. That's no good. You need it over your nose, over your mouth, and you need it when you're in a public space, particularly inside, so shopping centres, shops, out and about, and in any of the places you interact with other people, is a really, really good protection. Obviously not 100%, and vaccination is what is going to then get us through this.
Okay, thanks, Professor. So just quickly before I go back to Dr. Hansra, is so how long after you've been vaccinated, how long are you usually protected for? Do we know yet?
Okay, so I'll cover one. Basically, with the vaccine, it takes about a week or two for you to actually get protected from the dose 1. So, and then that gives you a bit of protection, but not as good as Dr. Hansra said, as the second one. And after you've had the second one, again, it takes about a week to 2 weeks for you to be fully covered. So the longer post second dose, the better coverage you have. In terms of then, if you actually get infected with COVID, with Delta, it does seem that people are being infected for longer than they were with the previous variant as well. We're actually getting reports from the hospital of people who are still actively infectious with the Delta 4 weeks after them coming down with the infection. So by and large, we're saying most people, it's that, period of time is sort of, about 2 to 3 weeks, but that's not the case for everybody, unfortunately. So there are some people who will actually be needing to isolate for longer because they're still actively shedding virus.
Thanks, Professor. So Dr. Hansra, one of the common questions we hear also are people that are on medication. Will the vaccines interfere with those medications?
Yes, thanks, Mr. Mayor. So not specific, there's not specific medications that, we list and say, okay, this is a worry for you to be able to have the vaccination. It's more if those medications are to treat an underlying medical condition that you may need to discuss with your doctor. So there are not a lot of medical conditions that are what we call contraindications to, that means you shouldn't have the vaccine if you've got that medical condition. There aren't very many conditions at all on the list for those, but there's a couple that might mean that you have to have one vaccine over the other. So it's always important, if you do have any medical conditions, you're not sure if you're okay to have a vaccine or which vaccine, that you discuss that with your GP. Don't make assumptions. As Professor Hespy said, it's actually even more important for most people with underlying medical conditions to get vaccinated early. And you'll probably notice that from the national plan that we put out for eligibility criteria. We put people who have medical conditions up first and early because we want to protect them, because they're more likely to end up in intensive care or potentially die from the virus if they do get it. So if you are on a medication, you're not sure, talk to your GP about which vaccine you should have, but certainly don't assume that there's a problem with you having it.
Awesome, thanks for that. And this is a bit of a tricky one, I guess, because now there's a new variant that's emerging, which is called the C12, I think, or C1.2. I'm not sure. That I saw something about it yesterday, but one of our community members had sent this in. And what are the dangers? Do we know of any of the dangers regarding that variant yet?
Yeah, so look, the World Health Organization is monitoring all of the emerging variants, and there are variants that are continuously coming through. You might hear terms of the Mu variant and the Lambda variant, and sometimes they're referred to based on the country where they've been picked up. Sometimes they're given Greek alphabet names, and sometimes they're given more scientific terms. What WHO do, World Health Organization, is they monitor these, and then they classify the variants according to how worried they are about it. So that either call it a variant of interest, which is, oh, we're a little bit concerned, let's keep an eye on this, or a variant of concern. And obviously Delta is a variant of concern. When it meets the variant of concern criteria, that's because it has the potential to cause more severe disease, or it has the potential to be more transmissible, or they have some concerns that the vaccines may not work. So if it's a variant of concern, such as the Delta, the WHO will list it as a variant of concern, and then that's when we really start to get worried. So I think we will continuously see variants that come up. This particular one hasn't been put into a variant of concern by WHO. Every variant is being monitored, so that may change into the future. But I think people need to understand that variants are normal for all viruses, and because we're being super kind of microscopic on looking at everything with COVID, you will hear a lot of things that may not amount to anything. So I wouldn't get overly worried. We're still showing that vaccines work for variants like Delta variant. And as I said before, the vaccines, it's not like we've got the vaccines and we're finished now. Those vaccines are continuously being worked on and modified and responding to any variants of concern that are coming up to make sure that any future doses that we need are going to respond to those variants. So certainly not something to be alarmed about. And I think, we'll certainly hear more if it becomes a variant of concern.
It's a bit like the flu strain that changes from time to time, is that right?
Yeah, absolutely.
And Professor, so just back to you, there's always been a lot of talk, and this is another question that's come through from one of our community members with regards to effective medications. So there's been a lot of, news sort of going around on social media and YouTube channels and so forth that you can actually fight COVID with medications and you don't need to be vaccinated. Well, I think one of those was ivermectin or something which is supposed to kill parasites. Did you want to sort of make a comment on that or answer that question on what the scientific beliefs are?
I will. So look, there's been, as we know, when we first were exposed to COVID, we knew very little about it. So there were a huge number of trials that went out about looking at effective medications. And can I say, one of the real joys about COVID has been the way in which the medical and the scientific community around the world has collaborated together to do a lot of this work, so that we can rapidly bring out evidence about whether things are worthwhile or not, and then pursuing them. Now, that's meant that we already have some really good medicines that have actually demonstrated that they help people who are really sick with COVID to actually fight it better. And one of those medicines is dexamethasone, which is being used in Australia and around the world for people who get sick, and actually makes people be less sick and more likely to survive than otherwise. Now, ivermectin was very early on put forward as a medicine that might be of value, and people looked at it both as a medicine to treat somebody with acute COVID, and also as a medicine to prevent you getting it. Can I say that it has been disproven on both fronts to do either of those things? So do not waste your time, do not waste your money, and please do not use it as a substitute for getting vaccinated. It is just not proven to be of any benefit whatsoever, whereas a vaccination does do all of those things for you. There is a couple of medicines that have just arrived in Australia. They're in this family of groups that were medicine, I'll call them MABs. And basically they're very clever, but they actually give you an antibody that fights the virus with you when you're really sick. So if you're a person who is actually not vaccinated and is demonstrating quite significant risk of getting quite sick with COVID, but before you actually get sick, so maybe you've got diabetes, maybe you've got some other particular reason, then we are able to now give that medicine in hospital to try and prevent you getting really sick. So but that is not ivermectin, and it is not hydrochloroquine. Don't waste your time or your money with those. They've been really, really well researched around the world because they were put out there big time, and then they're not delivering the results that you would want.
So there's no scientific evidence to show any drug that could be used as a prevention drug to catching COVID?
No, there's no prevention drug for COVID. That there is a prevention for, and that's a vaccine. And we have 2 of those in this country. Go and get one.
And just quickly before I go over to Dr. Hansra for the pretty much last question. So for people that have caught COVID, can they catch COVID again?
Yes, they can. And it's an interesting phenomenon. And again, in Australia, we haven't really seen this very much. We're seeing it's more emerging from countries like the United Kingdom and in Europe, where they've been so much more battered by COVID than we have. We've been so lucky to have had such a good, we've had a much better time with COVID than those countries. But what they've shown is that there are people who will get it. You lose your immunity after not that long a period of time, actually, and then you're at risk of getting it again. And it seems to be, again, more with some of the younger people who are not getting as sick as other people. And so maybe it's because they're not mounting as good an immune response in the first place. This is an area that we're going to be researching more, which again goes to that question. I didn't answer it fully about how long does the vaccination last for. What we are seeing, again, with the evidence that's coming from overseas, is that both the Pfizer and the AstraZeneca are giving good protection for at least 6 months. But at that point, they may start to need that 3rd vaccine, but we don't know if that vaccine, how long that will last for, because there hasn't been long enough a period of time. But the hope is that gives you 3-4 years of protection. But it may well be, because of the way the virus changes, like Dr. Hansra was talking about, and like with the flu, we may need what we then call a booster, which is a vaccine that protects you more from the variants as they start emerging.
Thanks, Professor. And the final question we have is for you, Dr. Hansra, which is, what is it that our bodies don't produce naturally to fight against coronavirus? Will our bodies ever produce them? And why can't we be vaccinated with something that will be a bit more permanent or be more permanent?
Look, that's a tough question. Look, I think we talked earlier about vaccines being used to train and stimulate our own immune systems. And I think it's important to recognize that our bodies are amazing. We get exposed to all sorts of germs every day that we fight off, and most of the time we don't even know that we're doing it. So our immune systems are fantastic things that we have as part of our physiology. But sometimes they're overwhelmed, and sometimes they're exposed to new things that we haven't yet been trained or we haven't had experience with. But the good thing about our bodies and our immune systems is they actually also evolve and adapt. So that's not to say in the future that just as the way that viruses change and adapt, so do our immune systems. And there is some research coming out showing that our immune systems, because COVID has been around for a little while, that they're starting to demonstrate in some studies that we are starting to adapt our immune systems over and above what vaccines are giving us. So I think it's one of those things where we need to watch this space really closely. And I know that people are a bit anxious about this idea of boosters forever. But I also think that we're still learning as we're going along, and learning really quickly. And as Professor Hespy said, the most amazing collaborations of research organisations globally coming together, which is why we're able to do this so rapidly, because we've got rid of all the red tape, we're bringing all the research together, we're centralising any kind of knowledge and things that people are discovering. And we may find that in a few years down the track that our bodies have adapted, and we're actually, like the flu, much better at responding with our own immune systems. But we really don't know. And I think that's the important thing. What we know is what we know right now, and what we know is get vaccinated. And that is our best protection against COVID as of today. What might happen in a year's time, we're still not there yet. But today, if you've got access to a vaccine, and whichever vaccine you have access to is the best vaccine, get it in your arm. Like that's the message.
Well, thank you. And that was our last question. And thanks to all our community members for sending those questions in. We haven't had any other questions come through on the chat, and it's just on an hour now that we've been going. So I think we've covered many topics on the vaccine. I think what we really learned and is that COVID is real. I think it's great that you've been able to answer that. And the best treatment or prevention for COVID is the vaccination. And both vaccines that are out there that are widely available in Australia at the moment is the AZ and the Pfizer, which are just both as effective as the other. Did you want to, either of you, add anything that we may have missed that you think you should add?
No, I think just to reiterate Dr. Hansra's final comments, the best vaccine is the vaccine in your arm now. And you have to have a first vaccine in order to be able to get the second vaccine, which is what gets you fully protected. So go and get that first vaccine now. We want to see you protected. We want our community to be able to move forward and not have to be locked down.
Dr. Hansra?
No, I think Professor Hespy said it all. And if you don't want to do it to protect yourself, do it so we can get to 70 and 80% and people can have some of their freedoms back. And also think about your loved ones. You may not be badly affected by it, but I'm hearing heartbreaking stories of people bringing it home to people they really care about and get very sick. So, you know, think about the others in your life. So that's just my message. Get out there, walk into a pharmacy, book in with your GP, book in with a hub, just get it as soon as possible.
Well, thank you to both yourself, Professor and Doctor, for making time and yourselves available to join us on this forum. I think it's been fantastic, and thank you so much to all our frontline health workers. I visited our hub here yesterday, and it was just amazing to see all the medical staff, and there was a doctor there and who was a local, and also all the nurses and health staff that were there, getting people through their vaccinations and looking after them. The aftercare also was fantastic. Thanks again for your time. Thanks to all the community members that were involved and participated. Also to our state member, Jodie McKay, who was on board. Just quickly before we go, just want to advise our residents that today we had a webinar with the Health Minister, Brad Hazzard, and the Chief Health Officer for New South Wales, Dr. Kerry Chan, and we spoke about putting across, taking Burwood off the hotspot area list, considering we've only had a handful of cases over the last week, but also that we can possibly get a permanent walk-in vaccination hub, because it's important to get the vaccines where the people are, because we're getting so much demand in Burwood. We did hear today, which has been announced on our social media and e-news, for those of you that want to subscribe, that they've extended the hub now till the 7th of September. So that's for Pfizer vaccines, for those that are still wanting to or sticking to the decision to get the Pfizer. But there are a number of medical centres and pharmacies in the Burwood LGA which are delivering the AstraZeneca vaccine. There's one on Victoria Street, the medical centre there next to Jodie McKay's office, which is getting people through quite efficiently on a daily basis. And it's great. And it's great to see so many members of our community that are interested. Have a good evening. Please keep safe and continue to ensure that you keep safe, even for those of you that go out and get vaccinated. Still important that we still practice our social distancing, considering that you could still transmit the virus even though you are vaccinated. So stay safe, and thanks once again for participating, and thanks again, Doctor and Professor, for being involved, and our council staff who have been working very hard behind the scenes, helping us put these forums together, and we're holding a number of forums coming up in the coming weeks. Thanks again and have a good evening.